Welcome back to the Carlisle Med Gym for part 6 of our series on hip mobility. The past few weeks we've been talking about hip mobility exercises and drills that you can do from home without too much equipment to start working on hip flexion and hip extension. So we've been really working on those two tests that we did up front, the active straight leg raise and the Thomas test, where you're working on testing your hip flexion and hip extension on opposite legs. So we want to branch out a little bit from that this week to talk about not just the sagittal plane, or in other words, the straight on hip flexion and extension, but more of the rotational hip mobility needs that most people have. So rotational hip mobility tends to be lost quite frequently in people, especially as they get a little bit older. And the biggest thing with that is, again, making sure that we're not compromising the low back or the knee health because we're losing rotation and mobility at the hip. So we're going to talk about external hip rotation today, and we're going to show you a drill called the figure 4 hip stretch that you can use to really work on enhancing your rotational hip mobility. So as a reminder, since it's been a few weeks since we first showed you our tests, we looked at testing external rotation in a seated position. So if I take a seat here on the table, as a reminder, the test was to maintain nice tall posture, cross one foot over the other knee, and look at how far down you can get this leg to rotate. So that's hip external rotation as we rotate down this way. And so our criteria was pretty basic, just that you can get your knee past about 45 degrees here. So if you can get it down towards horizontal, that's ideal. Unfortunately, what I see in a lot of people who've lost hip mobility is that from this tall seated posture, they either have a challenge getting it down past 45 degrees, or they can't even get the foot to cross over the other knee because they don't have enough range of motion at the hip. So as I mentioned, when that happens, even daily things like trying to put shoes on can be challenging and can even cause you to put a lot more torque and twisting on the knee and the low back as well. As you go to lift the leg up, you may have to flex and compromise spine health just to make up for the lack of hip mobility. So to work on this, I'm going to set up on my back on the table, and we're going to work on some rotational hip stretching. So I'll set up down here, and as I said, I call it a figure 4 hip stretch because we're going to cross one leg over the other just like we did seated, but it's a little easier to get to from a laying down position, and it looks like the number 4, so we call it a figure 4 hip stretch. And all we're going to do from here is just the same idea. We're going to cross that leg over and put a little bit of rotational pressure down away from the body. So as I do this, I should feel a nice stretch in the back of the hip and the outside of the hip, not pinching on the front of the hip. And we can really modify this stretch based on the needs of the individual. So some people might feel a little more stretch when we get more rotation, and some people might feel a little more stretch when we bring up some flexion towards you and then encourage that rotation at the hip. So you can really modify this to add some bigger challenge or to just create more rotation. And finally, if we go back to the seated position, we can come back to basically what we tested, but work on that from a more challenging position as we maintain your posture here. Don't let the back collapse. Cross one leg over the other and work on that from a seated position. So a little more challenging way to access that hip mobility now that you're in a tall posture. But that gives you a few ways you can work on your external rotation right now from home, and make sure that you're not compromising knee health or spine health by lacking that hip rotation.